Physician perspectives on patients using ChatGPT and similar AI tools for health information are complex and evolving. Many clinicians genuinely welcome well-informed patients who come to appointments with background knowledge about their conditions, thoughtful questions, and engagement in their healthcare. Informed patients can participate more actively in shared decision-making and may be more adherent to treatment plans they understand and help choose. AI that educates patients about health topics, helps them organize symptoms, and prepares them for medical visits can enhance rather than hinder the doctor-patient relationship. However, there are significant concerns and frustrations. Misinformation is a major issue. Patients sometimes arrive with confidently held beliefs from AI that are medically incorrect. Correcting misinformation takes time and can create conflict if patients are invested in AI's version. The phrasing matters. Suggesting a doctor is wrong because ChatGPT said something different creates an adversarial dynamic. Patients may feel confused or distrustful when the doctor's advice contradicts what AI told them, not understanding that AI has fundamental limitations in assessing individual circumstances. Altered expectations are another challenge. Patients sometimes arrive requesting specific tests or treatments they learned about through AI without understanding why those might not be appropriate for their situation. They may expect doctors to justify why they're not following AI's suggestions rather than understanding that medical decision-making involves individualized assessment that AI cannot perform. This can make appointments longer and more contentious as doctors explain why internet or AI research doesn't apply to this patient's specific circumstances. Time is a constant constraint in medical practice. If significant appointment time must be spent correcting AI misinformation or explaining why AI suggestions don't apply, less time remains for actual medical care. Doctors already face pressure to see more patients in less time. Additional burden from AI-driven misinformation or unrealistic expectations makes this worse. Some physicians report that certain appointments now feel like debates about information from AI rather than collaborative medical care. There's also the problem of patients self-diagnosing through AI and then seeking confirmation rather than evaluation. Someone might arrive convinced they have a specific condition because AI analysis of their symptoms suggested it. They present their self-diagnosis rather than objectively describing symptoms and letting the doctor evaluate. This diagnostic anchoring can actually interfere with proper medical assessment. The doctor must overcome the patient's preconception rather than approaching the case with clinical objectivity. On the positive side, some patients are better prepared for visits through appropriate AI use. They've thought through their symptom timeline, organized their concerns, research their chronic condition, and come with informed questions about management. For patients with rare diseases or complex conditions, AI research might surface questions or options the patient wouldn't have known to ask about. This can lead to richer, more productive conversations. The difference is between AI use that educates and prepares versus AI use that misinforms and anchors. Strategies for clinicians to navigate this new reality include asking about AI use during history taking, including questions like, "Have you looked up information about your symptoms online or using AI?" normalizes this behavior and gives doctors insight into what the patient already believes. If the patient used AI and got concerning information, the doctor can address it directly rather than discovering conflict later. This also signals that the doctor is open to discussing information from various sources rather than being threatened by informed patients. Providing vetted resources helps direct patients toward high-quality information. Instead of hoping patients don't use AI, doctors can recommend specific trusted sources and explain how to evaluate health information critically. Some practices are creating patient resource lists, including both traditional sources like medical society websites and guidance on appropriate AI use. This proactive approach acknowledges that patients will seek information while trying to steer them toward quality sources. Advocacy for clinician-facing AI tools addresses the power imbalance. If patients have AI assistance, but doctors don't, it creates an odd dynamic. But if clinicians have AI tools that help them access current evidence, organize differential diagnoses, and communicate with patients, they can match patients' information access while bringing medical judgment to bear. Clinical AI tools that complement rather than compete with patient-facing AI could help everyone. The physician maintains authority and expertise while acknowledging that information access is democratized. The ultimate goal is partnership. Patients using AI to become informed, organized, and engaged can enhance medical care if doctors approach it constructively rather than defensively. The key is patients understanding that information is not equivalent to advice, that AI cannot assess individual circumstances, and that doctors' recommendations are based on examination and clinical judgment that goes beyond what AI can provide. When patients see AI as a learning tool rather than a replacement for medical judgment, and when doctors see informed patients as partners rather than threats, AI can genuinely improve healthcare interactions rather than degrading them.